Hi guys, welcome back to Nursing Guru. Myself Manoj. Today let's see another important topic. Earlier we have seen the breastfeeding, right? What is breastfeeding, breast milk, process, lactation, physiology, everything. Now we know what we have to do after the birth of the baby up to the 6 months of age. So after that, we should follow the same process of breastfeeding, that is the exclusive breastfeeding. There should be some modifications, right? So that the growth and development of the baby would be achieved in a better way. So what are those modifications could be done after the 6 months of age? So that is what about today's class. So it is all about nothing but a weaning. What is weaning or complementary feeding? Weaning is also known as a complementary feeding. So let's discuss one by one in detail, starting from the definition and the guiding principles. Actually, there are certain principles, up to 10 principles that are established or approved by the WHO as well as the UNICEF, and the quantity and frequency of weaning foods that are recommended for children from starting from 6 to 23. Okay, so and next we'll see the factors and etc etc. Let's go one by one. First thing, we'll start with the definition. What is the definition of a complementary feeding or weaning? Complementary feeding or weaning is a process of giving an infant, other foods and liquids along with breast milk. Okay, along with breast milk up to 6 months of age, as breast milk alone is no longer sufficient for the baby to meet the nutritional requirements of the growing baby. Clear? So as there is no that much enough quantity only from the breastfeeding after the 6 months of age, this weaning process or a complementary feeding had been implemented. So from this complementary feeding, the optimum growth and development of the baby after the 6 months of age, along with the breastfeeding, there would be some other foods and liquids could be given to the baby so that the growth and development would be achieved, as well as the nutritional needs could be achieved. Clear? So, and also we can say that the complementary feeding or weaning is customized. Okay, it is a process by which the infant gradually customized or accustomed to the adult diets. So at the end of the weaning process, the baby starts having food what we have. Okay, what the adults have, the same food the baby starts having it. So this is all about the complementary feeding and weaning definition. Now let's discuss the consistency or the quantity and frequency of weaning foods. So let's see some of the weaning foods examples. So there are three forms of examples we can give. One is for the liquid, and then is the semi-solid, and then will come the solids. So these are the three forms of weaning foods that we can give to the baby. Starting from the liquids. In liquid, what are the types of foods that we can give to the baby along with the breast milk? So since it is a liquid, we have to give to the baby in the liquid form like vegetable soups. Let's say vegetable soups can be given to the baby, and fruit juices. So these are the things that we can give to the baby in the form of liquid form. And second will be this semi-solid. Semi-solid means is nothing but a partially solid, like the mashed potatoes. We can give mashed potatoes or mashed rice or the soft foods that could be given to the baby so that it is easily digestible for them. Okay, and the third one is the solid. Solid is nothing but what the food the adults have, especially what we have, the same food that could be given can be given to the baby as well. Because at the end of the weaning period or complementary feeding, the baby will be having capacity of digestion and tasting everything as adults like. Okay, so these are the examples of weaning foods, like liquids, semi-solids and solids. And next we will see the consistency and the frequency or the quantity of weaning foods that are recommended for children starting from 6 to 23 months. which is approved by the WHO as well as the UNICEF. So actually it includes 5 different components, starting from the age as well as the energy that are needed in addition to the breast milk. Okay, how much of energy that a baby should require in addition to the breast milk, and the consistency, whether it is liquid, solid or semi-solid, as well as the frequency, and finally will be the quantity. So these are the 5 components that covers in this tabular column, or these suggestions that are given from the WHO as well as the UNICEF. So whenever the examiner asks in the viva, especially in the practical exam, either in the OBG or a child health nursing, sometimes in the medical surgical as well, you can give these points so that you can score high marks. And also you can implement these 5 tabular column in your exam if they ask for 5 mark questions about the weaning. Okay, so let's discuss these 5 components starting from age. So let's say these 6 to 23 are divided into 3 parts, starting from 6 to 8 and 9 to 11 months and the 12 to 23 months. So in these 3 groups they have divided. So let's take or discuss one by one, starting from 6 to 8 months. So in 6 to 8 months of babies, that is 6 to 8 months of age, the babies who comes under this age, what is the required energy in addition to the breast milk is 200 kilocalories is the energy required in addition to the breast milk to the age of 6 to 8 months. And next, what is the consistency that should be given to this kind of babies? The liquid consistency. As we discussed earlier, the vegetable soups and any other soups, fruit juices, we can give for this type of group babies who comes under 6 to 8 months. Okay, and what are the frequency that we can follow here? 2 to 3 times per day we can feed the baby. With the amount, what are the quantity, how much quantity we can use? Remember that the weaning or the liquid food should be started, because this is a weaning process. Immediately you should not start, or immediately you should not stop the breastfeeding. Along with that you have to continue it, right? So start with 2 to 3 tablespoons of feeds or the weaning foods what you are giving, especially in the liquid form, and then increase gradually to like 125 ml. Okay, 125 ml, up to 125 ml you can increase the weaning foods. And second group will be like 9 to 11 months. So in this 9 to 11 months of age babies, the energy that are required in addition to the breast milk is 300 kilocalories. Okay, 300 kilocalories with the consistency of semi-solid. As I said earlier, we can give mashed potatoes and mashed rice or mashed pulses or whatever. Okay, but it should be easily digestible for the baby. And next, what is the frequency? Same as that, you can give with the frequency of 2 to 3 times per day, and the quantity will be like up to half cup of the 250 ml. Okay, you should give half the cup of the 250 ml. And the third group that we can see is 12 to 23 months. So what the age, within this group of age, the babies will be requiring an energy in addition to the breast milk is 550 kilocalories, or 550 kilocalories with the age 12 to 23 months. Okay, what is the consistency they require? They require solids as adults can have. Whatever the solid foods like cooked rice, potatoes instead of mashed potatoes, they can eat or have biscuits, bananas, etc., etc. And next, what will be the frequency for this kind of group of babies starting from 12 to 23? So the frequency will be like increased in frequency 4 to 5 times or 4 to 5 meals a day. Okay, 2 to 3 for those two, and here 3 to 4 or 4 to 5. Probably will be like 3 to 4 meals per day. And what is the quantity? Quantity will be like 1/4 the cup of 250 ml. Okay, this is the tabular column that contains the 5 components of weaning foods for children that are recommended by WHO as well as the UNICEF, starting from 6 to 23 months. Now let's discuss the principles which are most important in weaning process. okay, in the complementary feeding as well as the weaning. That is the guiding principles for complementary feeding. These are standardized ones that are approved from the WHO as well as the UNICEF. So please do remember all these 10 principles which have made very condensed so that it could be easily understandable for you people as well as it is more easy. I have turned into a normal terms I have coined in such a way that you could understand easily instead of studying the entire points in the textbook. Okay, so let's discuss one by one, or let's see one by one. The first principle, we said that there is a 10 guiding principles for complementary feeding. The first one is the principle number 1: practice exclusive breastfeeding from birth up to 6 months of age, and introduce complementary feeding after the 6 months of age and along with the breastfeeding. Okay, practice exclusive breastfeeding until 6 months of age, okay, starting from the birth, and introduce complementary feeding after the 6 months of age along with the breastfeeding. Okay, along with the breastfeeding. And principle number 2, what is the principle number 2 says is continue frequent on demand breastfeeding. Continue frequent on demand breastfeeding so that the optimum growth and development would be achieved. Okay, demand breastfeeding for up to 2 years of age or above or beyond. Okay, continue frequent on demand breastfeeding for up to 2 years of age or beyond. This is the second principle. And third principle, principle number 3, practice active feeding or responsive feeding, which is nothing but the effective feeding. Active feeding is nothing but effective. Okay, practice active feeding or responsive feeding by applying the psychosocial care. As I said earlier, it has to be some emotional bond between the mother as well as the baby. And the principle number 4, what principle number 4 says is practice good hygiene and or safe handling processes. Okay, practice good hygiene and safe food handling, especially food handling. Practice safe food handling as well as the good hygiene so that it could reduce the risk of diarrhea in babies. Clear? This is the principle number 4. And principle number 5. What does principle number 5 says is start the complementary feeding after the 6 months of age, starting from smaller amounts of food, gradually increasing to the larger amount of food along with the breastfeeding. Clear? Now let's see the 6th principle of guiding or the guidance principle for complementary feeding. What is the principle number 6? Here what the WHO says is gradually increase the consistency and variety of complementary foods. Okay, gradually increase the consistency and variety of complementary foods so as the infant grows older. And next, the principle number 7, gradually increase the quantity or the frequency of weaning foods or complementary foods as child gets older. So this is principle number 7. And next, let's move to the principle number 8. What the principle number 8 says is feed a variety of rich nutrients that are good enough in the weaning foods. Okay, especially the micronutrients, vitamin supplements, mineral supplements. Okay, nutrient rich foods so that the nutritional need of the baby is met should be ensured there. So next, let's move to the principle number 9. What does this principle number 9 says is always do remember that the complementary foods or weaning foods should be rich in nutrient so that the child should not go under malnutrition. So it should be, the nutrients should be rich in like iron, minerals, vitamin supplements, mineral supplements, etc. Okay, the principle number 10, the last principle. What does that principle number 10 says is just to start, because it is advisable to start from 1 to 2 teaspoons. Okay, whatever the new food we start to the baby, it is advisable to start with the 1 or 2 teaspoons of new food so that the allergy could be prevented. Okay, so because food allergy is the major cause, especially in the babies, because they are trying it for the first time. So this is what the principle number 10 says. So now we have discussed starting from principle 1 to the principle number 10. Now let's move to the small topic called the problems. What are the problems that the child faces during the weaning? So especially the child faces a psychological problem because since the baby was fed on breastfeeding during the first 6 months of age, then immediately shifting to the complementary feeding along with the breastfeeding, the baby may feel some demand on the breastfeeding. Okay, so there is some psychological disturbance or effect that could act on the child. And the second, the problem what the baby or a child can face is allergies. Because as I said earlier, we have to first feed in the first 1 to 2 teaspoons, so that if any allergy is noted, could be sought out or managed there itself. So allergy will be also one more problem, that is diaper sensitivity or food allergy. Okay, and next will be like more emotional, not only the psychological and also the emotional disturbances will be like a problem, especially during the weaning. Okay, and also the diarrhea. The why diarrhea or like GI problems, abdominal pain, this arises as a problem during weaning process is not following the good hygiene and safe handling practices. Okay, if we follow these good hygiene and safe handling practices, safe food handling practices, these type of dishes like the diarrhea, abdominal distension, abdominal pain or stomach pain could be prevented in the babies. Okay, in the babies or a child. So these are some problems that could be faced by the child during the weaning process. Okay, this is all about the weaning or complementary feeding, starting from the definition. Okay, we have discussed about what is complementary feeding as well as the exact definition, what it means. Okay, and next we have discussed about the quantity and consistency, what are the nutrients that are required with a tabular column of 5 components that are approved by the WHO as well as the UNICEF, and the guiding principles that we have discussed, and weaning foods example. Okay, and followed by that finally the problems that are faced by the child during the weaning process. Clear, right? These are the topics or the importance that are covers under the weaning. So I hope you all clear about the breastfeeding as well as the weaning now. So this is the end of the topic. If you have any queries or questions, please do comment in the comment chat box so that I could rectify or could be cleared in the later classes. Clear? Okay, thank you guys. See you in the another important video. Bye.